Unknown. One group considered high risk for more serious COVID illness, cancer patients. Oncologist Dr. Mike Finan from Singing River Health System joins us with more. All right, Dr. Finan, thank you so much for joining us today. We're going to talk about the implications of COVID on cancer patients, but first, let's talk about the numbers. We have 680 new cases today in Mississippi. They're continuing to rise pretty significantly in South Mississippi, especially Harrison County. The CDC saying today this is just the beginning around the country and in Mississippi. So what are your concerns when you look at these numbers?
Well, I think that's probably not the right metric to look at. I think we need to really look at the death rate, the hospitalization rate, and the ICU admission rate, the rate of patients on ventilators, and those are still low. And actually, if you look at the rise in positive tests, much of that is among population that's younger. So I think we still need to be cautious. We still need to be on top of our game. But I'm not so concerned. I think the spread of the virus amongst healthy young people will help with herd immunity as long as they can stay away from the elderly and the infirm.
Right, and if they are going to be around people who are at higher risk, all the health officials keep pushing wearing masks, social distancing, and that type of thing if they do have to be around some of these people. So that's a good point. Now, what about cancer patients? Because with their systems often being immunocompromised while they're going through treatment especially, how have you dealt with that, and how big is their risk of having a more serious illness if they were to come into contact with COVID?
Well, that's a good point, and that's one reason why we're talking today. Is cancer patients are immunocompromised. Many of them are taking steroids, or with steroids suppress the immune system, and many of them are taking chemotherapy, which also suppresses the immune system. So they are at significant risk. I will say that we are still testing at both of our treatment sites, Singing River in Pascagoula, Singing River in Ocean Springs. We're still taking temperatures at the door. We're still doing the screenings. So we're still being very cautious. The healthcare staff is all wearing masks, and we're asking patients to wear masks. So I think we are being extra cautious because our population is immunocompromised.
And really, even from what I've been reading, survivors are often at higher risks too, just because their immune systems may be weaker. So it's not just people who are currently patients receiving treatment, but people who have had treatments in the past too, right?
That's true in some cases. It depends on which treatments they received. Obviously, some cancers are treated just with surgery, and if you had a cancer that was treated with surgery and you're cured or in remission, then I think you're likely to be in good shape. But I think patients who were heavily treated with chemotherapy and radiation therapy, that definitely affects the immune system and can affect it for many years, depending on the treatment regimen. So they're not all the same, but I would say if you've had cancer and if you've had chemotherapy and or radiation, you should probably be a little more cautious.
All right, Dr. Mike Finan from Singing River Health System, oncologist there. Thank you so much for sharing this information.
Yes, ma'am. Thank you.